My patient has beautiful structure, but her main concern is the fine lines and wrinkles in the upper face. I'm using filler to treat some of the upper lines, but I'm also combining it with Botox. Now, Botox and filler do completely different things, but they can work very well together. As you can see, she has a habit of frowning, so Botox will paralyze the muscle and stop that habit. On the other hand, dermal filler is made of hyaluronic acid and is great at improving the quality of the skin. It will hydrate the skin and soften some of these lines. To treat this, I'm delicately and carefully injecting the deeper lines. I take extra care not to bruise her and make sure she's very comfortable. Slowly you can see the lines are disappearing, but the results will only get better over the next few weeks. Finally, I'm just finishing off with a little bit of Botox to stop that habit and weaken her very strong muscle. My beautiful patient felt that she looked tired. She's a mother of 2 and has seen the most impact around her eyes. She doesn't know exactly what she needs, but she wants something exceptionally subtle and natural. I always start by doing a full face assessment. I make a plan and discuss the options and the impact of the treatment. I make a plan with some markings which can help visualize the treatment for our patient. For Ariana, we're going to be treating the mid-face, an area that is often forgotten. The idea behind the treatment is to blend her tired under eyes with her beautiful cheekbones. I'm using a cannula. This is a little straw that helps fill the area without using a needle. This means Ariana won't have bruises or swelling and can resume with her daily life as normal. I'm keeping the treatment exceptionally minimal, so I'm only using 1 syringe each side. And as you can see in her after photos, she looks very refreshed with very little swelling.
We have decided to do a skin pen treatment for Hania today. She came in concerned about pigmentation and fine lines and wrinkles. We discussed that skin pen will be the best treatment for her today. We are going to bespoke the treatment and adjust a microneedling depth to target her concerns. In terms of treating the pigmentation, we are going to keep the depth of the needles superficial so that we target the melanocytes within the epidermis. We will then increase the needle depth to target the lines and wrinkles, specifically on the forehead and marionette lines to stimulate the collagen production. Skin pen is a microneedling treatment in which we create a controlled injury within the skin to stimulate the skin's own healing mechanisms. This controlled trauma stimulates fibroblast production, therefore the production of collagen and elastin increases. The result is a plumper, more rejuvenated skin due to the improvement in texture, tone, and elasticity amongst others. We used skin pen to treat surgical scars, stretch marks, enlarged pores, facial acne scars, as well as fine lines and wrinkles, and dyschromias like melasma, vitiligo, sun damage, or solar lentigo. After the treatment, Hania's skin will be red for a few hours and feel a bit hot. It should settle down by tomorrow. I will next see Hania in 4 weeks to continue with her skin journey.
This treatment is a powerful combination of Hydra and Oxygen facial. It's suitable for all skin types and concerns general rejuvenation, pores, blackheads, acne, pigmentation, and aging. It starts with deep cleansing and exfoliating using superficial peel to lift impurities, followed by painless extraction to vacuum blackheads, dirt, and excess sebum. After, high-pressure oxygen is used to infuse hyaluronic acid, vitamins, minerals, and botanic extracts into the skin. This treatment will leave your skin more hydrated, bright, plump, and clear. It will improve signs of aging, reduce lines and wrinkles, and will increase elasticity. Results can be seen right after with little to no doubt.
My patient was concerned about the appearance of her nose. She feels that it's too long, very prominent, and droops down when she smiles. She has previously had dermal filler on her nose to make it seem more in proportion in her profile. On assessment today, I noticed that her chin was a little further back than her nose. It also looks flatter from the front. This can change patients' perception of their profile, where the focus becomes entirely on the nose. To address this, we're going to be treating her nose and her chin together. Treating the nose is a very delicate and precise procedure. I start by marking up the areas where I would like to add volume, carefully assessing the nose from all angles, particularly her selfie angle, where she notices her profile the most. Small drops of filler are then added slowly on the bridge of her nose. This isn't particularly painful, especially because I am using a small needle and injecting very slowly. Next, I continue with my profile balancing by treating her chin. I address two things with her chin. Firstly, the projection of her chin, meaning how far forward it comes, and secondly, the length of her chin, so how short or long it is. To create a natural result, I will not be using more than 2 syringes of filler in her chin. We can now see that her profile has changed and the proportion of her nose to her chin is much less significant. She's so happy and delighted with the results of this profile balancing procedure.